Hi, I'm DrRohrich, Rohrich Knows Podcast. Welcome back to this amazing series we're going to do with Dr. Missy Clifton. Welcome. How are you doing?
Thank you.
Great.
I'm wonderful, Rod. Thank you so much for having me. What an honor.
It's amazing. She is an amazing dermatologist that started her own practice 20 years ago. She doesn't look like
this year, 20 years.
She doesn't look like she's been in practice 20 years. So she practices what she preaches. She looks amazing. So we're going to talk about several topics. We're going to start out with hormone replacement therapy. She is the owner of Premier Dermatology. Tell us a little bit about that and how you started small and now you're big. Kind of like what Bentonville, Arkansas has done, right? It's an amazing place.
Yes. My town and I have grown hand in hand, thankfully. 20 years ago, I started the practice. It was myself and 5 employees. I was the only doctor, and we have just grown year after year. We started in a little strip mall and took over the strip mall over years, and then we built our own building finally because that was not working, and started recruiting partners, and now we're up to 8 doctors and
Wow.
lots of PAs and laser techs and estheticians and nurse practitioners and fabulous nurses and well over 100 staff members in 3 locations now. So
wow, amazing.
it's been fun.
That's the American dream.
Been very fun.
American dream. Okay, so Missy, tell us a little bit about hormone replacement therapy. And so you're a dermatologist. So how did you get you're interested in this, and tell me all about that.
So I think it's really interesting because, I'm 50 now. And a lot of my patients have been with me since the very beginning that we just talked about.
Yeah.
And they've aged with me. So a lot of us have gone from being in our 20s and 30s to now being in our 50s and sometimes 60s and 70s. And we're seeing the side effects of what happens when we lose those hormones. When you lose estrogen, your skin gets saggy.
Right.
Your energy level falls when you don't have your testosterone. You don't sleep well when your progesterone's out of whack. You get hyperpigmentation a lot of times when your progesterone's out of whack. So a lot of the things that I'm treating with these patients, I've been treated myself with hormone replacement therapy. And I've realized that so many doctors really think that it's just okay for women to go through menopause.
It's part of life.
It's okay for their estrogen levels to go away and their progesterone to fall apart and for them to not have testosterone. And I just think that that's wrong. I think that in this day and age, in the day of bioidentical hormones, which are extremely safe, I think women should be on hormones and be replacing them, just as if your thyroid was low.
Right.
Why wouldn't you replace your estrogen and your testosterone? So I just am a very strong proponent of women taking their healthcare into their own hands and really protecting themselves down the line, because it increases your longevity by increasing your mental capabilities. It's been shown to decrease Alzheimer's. If you're on hormone replacement therapy, you have less osteoporosis and breaking of bones. Your skin is better. You have less cardiovascular risk. So a lot of the things we're trying to prevent, hormone therapy helps.
So Missy, take me through that. So for a woman that's undergoing this change in their life, so what do you advise them to do? I mean, what do you tell? I mean, obviously you work with. Do you do this yourself? You work with an OB-GYN, or what do you do?
So I am actually getting my 3rd board certification in integrative health because I'm fascinated by this realm. I've spent about 8 months with the Hormone Health Institute getting certified in hormone replacement. And so I have been doing that myself. My best friend was a gynecologist who taught me a ton of things. Unfortunately, she passed away from a brain tumor in November. And just part of her legacy is helping her patients that she's left behind and trying to carry that torch. Because a lot of physicians, even a lot of gynecologists, really don't want to do hormone replacement therapy and do it really well. So there's just a need in my community and a lot of patient trust and a lot of patient questions. And so it just kind of made sense to start really educating myself and helping my patients with it.
So what are some of the myths that, it's, estrogen is dangerous, it can cause cancers and all these things. So tell us a little bit about that and how we can dispel that to everyone, males, females.
Right. So a lot of the hormone replacement therapy initially many years ago was synthetic. So it was, made in a lab. It wasn't really at all similar to what our natural hormones are. And now we actually have bioidentical hormones that are so incredibly like our natural healthy hormones. And they're so much safer. So there are studies out there that you will find that the older synthetic hormones did increase the risk of breast cancer and things like that. If you look at all of the newer studies with bioidentical hormones, you actually see a decreased risk of breast cancer and other cancers.
Really?
So it's kind of fascinating, but you really have to delve into the literature and you really have to have a discerning eye and look. We're, as dermatologists and plastic surgeons, we nerd out on studies. So we're really, used to looking at them with a critical eye. And when you really do that, you see that the true bioidentical hormone benefits are extremely high and they really outweigh a lot of the risks. Now, certainly if someone has, a hormone sensitive tumor or something like that, we're not going to be addressing that in any way. And we're going to work hand in hand with other physicians, including gynecologists and primary care doctors, if we're treating these patients. But the benefits do outweigh the risk in most cases.
So Missy, so in the average patient doesn't have any history of cancers or breast cancer or anything like that. So what is kind of your normal regimen for your female patient? And I'm assuming
so we have people come in, we do a full health screening. We see what are their symptoms, what medications are they on, what other, health problems and issues do they have. We do a full hormone panel that includes everything from thyroid to, all of their hormones, as well as cortisol and other things, just to kind of see what their overall status is. And then we see, kind of what their symptoms are, and we kind of match that to what they need as far as replacement goes. And it's very customized. There's not a cookie cutter,
I like that.
Recipe. Some people really don't want to do pellets, which I personally love pellets because I like going every 3 months and it's done and it's fairly steady state for myself and I feel really good. But some women don't want a surgical procedure. Some women want to do, topical creams, and oral progesterone is, of course, what we always do. We never do progesterone in pellet form. And oral progesterone is great for most people as long as it's micronized. So there's just a lot of little tricks. But every single patient, we make a customized plan. We recheck labs. We really hold their hand and make sure that, they're getting the results that they need and that their blood work is showing that.
So pellets are for estrogen and testosterone? Is that
correct?
Right? I'm asking because I'm really ignorant about this. And then the progesterone
you're not ignorant.
is topical, right? And those are kind of what you gauge them, and then you've got to make sure you're with a true bioidentical lab that does great work. Okay. And you do all that.
So we've really worked at finding pharmacies and compounding pharmacies that are super reputable.
Got it.
That, have been tested and really, are very rigorous about making sure that every batch of every hormone that they're giving us is going to be identical to the previous batch. So patients don't have any fluctuation there. And that's not super easy to find.
No.
You really have to do your research and make sure that those pharmacies are staying up, to snuff on all the regulatory and make sure they're doing things really well.
So what about males? Do you treat males?
We do treat males, and generally guys are a little easier, I will say.
Really?
You guys don't have ovaries, you don't have estrogen, testosterone. We don't have to worry about you having uterine bleeding. If you still have a uterus, like some women who still have their uterus at 50. So you guys are a little more straightforward. But I will tell you, I also, as a dermatologist, we treat a ton of hair loss. So I actually I have another company called MD Hair Labs where we actually do hair restoration and hair transplant. And what we've seen is a ton of men getting testosterone replacement, and then they're coming in with a lot of hair loss. And no one's ever told them that increasing their testosterone can push the amount of testosterone in their scalp to DHT, which makes their hair thinner, finer, and then fall out.
Ooh.
So no one's really warning men about that. So we've had to kind of backtrack when we're treating their hair loss and say, yeah, because your testosterone is entirely too high and it's pushing too much through that pathway, and you're not on any medication to prevent that conversion to DHT. So there's a lot of education for guys, especially where hair loss is concerned. And then I was seeing a lot of male patients with their hemoglobin and hematocrit going up so high that it was a dangerous level. So
really?
Even dangerous enough that they could be at stroke level. And they were actually having to go and have blood removed, almost like leeches back in the old day, the bleeding,
right.
To lower their hemoglobin and hematocrit because they were on too much testosterone supplementation and it was causing that problem for them.
You mean like those testosterone clinics and stuff that don't monitor people, right? And
they're really good at just monitoring by symptoms, but not really looking at people's lab work.
Right.
And I would see men coming in with new onset, really big, flushing and blushing and rosacea and lots of, hormonal type acne, lots of extra hair. And we would check their blood work and their hemoglobin and hematocrit would be out the roof.
Wow.
And that's dangerous.
Yeah.
So there were just a lot of people not doing it very well. And we just decided we wanted to be the ones helping to correct that problem.
Well, you absolutely look absolutely amazing, Missy. So you obviously practice what you preach. So would you share with us what you do? Is that okay to tell us?
Of course. Yes. So I had a hysterectomy several years ago.
Okay.
We kept my ovaries because we thought maybe I would get a little extra hormone out of them. But about 6 months later, my ovaries shut down completely, which often happens. When you take out your uterus, you compromise blood flow to the ovaries as well. So often your ovaries kind of quit over time. So I have been doing pellets. Started through my gynecologist and have continued to do that and just kind of tweak my dose as we go. I was not sleeping well. I was getting lots of melasma. Mm-hmm. I didn't have any energy level. My energy was gone. Everybody in my family dies of cardiovascular disease and my lipids were high. I was starting to get high blood pressure. So just lots of things were kind of falling apart. And once I started my hormone replacement, I'm just back to really feeling great. Lots of energy. My skin's healthier. My hair's healthier. Just overall, just things are better. Yep. And I'm sleeping. So everything's better if you sleep.
So I know. So it's a combination of estrogen, progesterone, and testosterone, and that balance. That's great.
So I do a little estrogen and some testosterone in my pellets, and then I take progesterone nightly.
That's awesome. So what, for our viewers, Missy, that want to look as great as you do, what are the 3 take-home points you have for them when they're trying to sort out this hormone replacement therapy morass? And it is a total morass. What you're saying, I mean, I actually have such a hard time sending people in Dallas because some of my OB-GYNs, like you said, they don't want to do it. And then they come back to me. So, I mean, I wish you were here in Dallas.
Well, I wish I could clone myself, Rod. There are so many places I would love to be. I'd also love to practice closer to the beach. Even though I'm a dermatologist, I'm not supposed to like the beach.
I love
really
the beach.
Do.
I'm moving. I'm gonna have a place in Florida. I'm moving. I'm having a place there. But I love Dallas too. So okay,
that's part of my end game. So I would say that the main take homes are you don't have to go through the suffering of menopause. It doesn't have to be what you do. But if you're going to get hormone replacement, you need to get a full panel of lab work. Yep. You need to make sure what your levels are. And then you need to make sure that the practitioner that is following you on a regular basis and really, making changes as they need to, not just based on your symptoms, but also on your lab work. Because a lot of the practitioners out there are like, oh, you feel great. We're going to just keep doing what we're doing. And down the road, that could be detrimental. So you just need to be having regular laboratory work, at least in the first, few times that you come in for replacement, to make sure that you're steady and that you're getting not only great results, but that your labs are supporting that you're in a healthy range.
Great. Well, wise words from an amazing dermatologist from Bentonville, Arkansas. Missy, thanks so much. That was amazing. So please leave us your comments and thoughts, and I'm sure we're going to have Missy back and talk more about hormone replacement therapy. It's a very hot issue, and I'll tell you, all those things I get every day from my patients as well. So thank you so much, Missy. See you soon.
My pleasure. Thank you for having me.
You bet.